Thank you then. Welcome to everybody for tonight's Community Leadership Overview and Scrutiny meeting on St George's Day. So happy St George's Day to everybody. We will be changing the running order of the agenda, but we will do that as we go along. So we've got item number 1, which is apologies for absence and substitution.
We'll receive apologies from Councillor Griffiths and Councillor Alexander's substitution.
Item 2 is minutes of the last meetings. There's actually 2 sets there, 14th of November and 11th of January, and obviously some notes there of the informal meetings and discussions which have taken place. But can I sign those through the record? Okay, thank you. Item 3, which is declaration of interests. If you'd like to, councillors invited to declare any disposable pecuniary interests as we go on. Item 4, which is questions.
Sorry, Chairman, that's just for councillors. If you've got a disposable interest, you should make that declaration now. And obviously at the time of the item as well. It doesn't sound like there's any declarations to be made on the business of tonight's meeting. No, that's fine.
Item 4, which is questions on notice. Law 38.
Chairman, we'll receive no questions.
So we're now going to take item 6. So that'll be the first item we're going to take, which is the report of the Assistant Director Partnership, access to NHS dentistry for residents in Tenbury. So I believe John's going to lead
Yes, I can introduce my colleagues. So,
John, just before you start, we obviously need to recognise there aren't microphones in this room, and so if everybody can just elevate their voice just a little bit, just to compensate for the fact that we don't have microphones in here. Over to you, John.
Thank you very much. So the committee has had our colleagues from the Integrated Care Board to your committee just over a year ago now, I believe, to discuss dentistry. And at that point, dentistry still came under NHS England. There's been a change since then, and it now comes underneath the Integrated Care Board. So, and Greg, my colleague here, is Greg Brown. He's Head of Dental Contracts and Performance at the Integrated Care Board. He's going to lead the presentation, and you've already heard from Nick as well, who's going to assist you. So if I can hand over to you, Greg.
Thank you. My name is Greg Brown. I'm the Head of Dental for Suffolk and North East Essex ICV, and I liaise quite regularly with Nick Barker, who is our co-chief dental officer for the East of England, who's joined us today as well. I've shared a report with the committee and a presentation back as well on dentistry. The presentation back has been to our board and our Integrated Care Partnership as well, as many other locations, and it will be going for scrutiny to the Essex and Suffolk County Councils as well for their feedback. So we know that poor oral health is a key driver of not just oral health issues, but mental health issues, diabetes, dementia. It impacts a very wide range of health. It impacts a wide range of people's health within, and it's all linked to dentistry. So we know that generally from national data, children's oral health is generally quite strong, but adult oral health is a weakness within Suffolk and North East Essex, something that we really need to work on, making sure that it is improved going forwards. Just a few points to note that NHS dental care is not universally free at point of use. It is available free for some on specific exemptions, and that the NHS is only actually funded to provide around 50% of NHS dentistry for the population as well. So that's been a long-standing metric of NHS dentistry, that we are only funded for 50% of the population as a ICB, or around 50% of the population. NHS dental services have had some long-standing issues. I've worked in urgent emergency care before this for 5 years, and I don't remember a month where I didn't discuss dentistry with our urgent and emergency care providers. We know that COVID has seen quite a big drop in access rates. So where in June last year, around 38.7% of the population had seen a dentist in the last 12 to 24 months. If you look back in September 2019, that was at 51%, so that's over 100,000 people that haven't seen a dentist less in the preceding 2 years. So when it came to us in April 23, it was in need of support, and we took on the challenge quite willingly, because we know that there are lots of issues there that we can, as an ICB, solve for our local population. So overall, 75% roughly of the commissioned activity is actually delivered within Suffolk and North East Essex. So the way the NHS contract works is that we pay providers to deliver their activity, and then if they don't deliver that activity, we then take that money back and use it for non-recurrent projects within the health service. Where we can, we will 100% spend that on dental projects, but most dental projects need to have a longer lasting project length than just a year, to help with recruitment and retention of staff, which is one of the big issues that dentistry faces. The recruitment and retention of staff is on the next slide, that's been shared, and I have also put into the pack. But what we have here is that we had a number of associates increase just before the pandemic, and then we've seen a quite big drop-off of the younger dentists within Suffolk and North East Essex post-pandemic. There are opportunities, though, that have emerged since the ICBs have taken over. So there's new contractual flexibilities. Historically, the contractual flexibilities were capped at 10%, but now they recommend on average no more than 20% flexible commission opportunities, which means we can take some of the contracts and change the values to ensure that we see those patients that we feel are the most in need, or for specific programs of work such as child-focused dental practices, or periodontics and endodontics. So that's a really complicated root canal work that's being done. Just to note, it isn't just primary care dentistry, so your high street dentists that have moved to us. There are orthodontics providers as well. All the orthodontic providers within Suffolk and North East Essex have moved to us, as well as our secondary care dentistry, which includes the oral surgeons and the maxfax surgeons within SNF and West Suffolk, and also the specialist tertiary commissioning. So something called TMJ, which is kind of your jaw joint, is also within our commissioning. We've recruited a larger team in the ICB to ensure that we can actually manage all of the workload that has been happening, and tackle some of the transformation projects that we're really keen to progress, as well as respond more quickly to patient queries that have been coming in. So as an ICB, we took on commissioning of the service last April. Just before that, we spent £1.5 million roughly on prevention, including around 300,000 or 400,000 in North East Essex. That has meant that we've been able to go into a number of schools. So 6 schools in the Tendring area have now had oral health champions. We've given 6 schools have also had some good lifelong smiles training, so 6 care homes had lifelong smiles training, and 5 schools had supervised toothbrushing, which means that we're educating children on how to brush their teeth properly to ensure that they do. And a little anecdote, but my sister is a teacher in Suffolk, and she's undertaken this with her students, and actually it's encouraged the conversations with their parents as well. So it's actually having an impact on not just the children, but their parents and other school children as well. So we've also invested in putting toothbrushes and toothpastes into community supermarkets and food banks, because we recognise the cost of living crisis has impacted people's ability to actually afford toothpaste and toothbrushes, and we really wanted to make sure that they were available to everybody to ensure that oral hygiene stays a top priority for the local population. We've been working with that project with Essex County Council, Public Health, all Leeds as well. When we first got in, we made the decision that we wanted to try and stabilise the market. Each practice is on a slightly different rate for the activity that they deliver. It's called the UDA rate. For me, it helps me. It's a widget that gets paid for specific services that are delivered, and basically, you get a different amount of UDAs for the delivery of the service that you provide, but it's changed quite heavily depending on the location and the history of the contract. So what we've done is we've brought all the contract values up to a minimum UDA level. The national team announced this recently in the National Dental Plan, but we've already implemented 95% of it already within Suffolk and North East Essex to £29.26. And then we also launched a new service within Ipswich. It was the first of a number of new services that we are looking to procure within Suffolk and North East Essex, and that went live last month, and primarily focused on supporting those within high priority groups and urgent emergency care need within Suffolk and North East Essex. There are no contractual boundaries. What we've also done is actually, one of the ideas came from this committee just over a year ago now, was around extended access. So we've offered extended access opportunities to our current providers within Suffolk and North East Essex and incentivised those with a sessional payment. And we've had a good uptake of around 20 practices spread across Suffolk and North East Essex, primarily in the larger towns, so within Ipswich and Colchester. West Suffolk is a little bit less, with a little bit less take up than the East and North East Essex. But we've also offered that flexible commission opportunity that I talked about earlier to practices. Again, we're asking them to see not just normal patients, but also urgent emergency care and high needs patients and high risk dental patients, as well as some specific groups where we know their oral health is worse. We've inherited, as I mentioned earlier, we've inherited orthodontics services. There was 2 orthodontic services that we received that didn't have an orthodontist working there. One of them is in Clapton, the other one is in Bury, and we're in the process of working with those patients to move them to different providers as this provider. And then what we'll do is we'll go out as part of our normal procurement processes to make sure that the activity stays within the region if we possibly can. And we have had interest from a number of providers within Suffolk and North East Essex to support those patients in the transfer as well. We also inherited another service that didn't exist within SNF, which is the orthodontic surgery, which is the jaw realignment surgery, and we're working very closely with SNF to ensure that service is up and running. We've continued to support the trauma services that we have within the Suffolk and North East Essex, where we've been able to make sure that those that are need urgent and emergency draw specialist care due to trauma, such as car accidents, etc., can access it as well. And as I said, we're also looking at how we can support dentistry going forward with different opportunities such as sessional payments to work evenings and weekends, as well as how we can enhance UDAs through flexible commissioning to make it a really dynamic service for the population going forward. Nick, was there anything you would like to say? No, I've said quite a lot there.
No, thanks, Greg. I think you set it out very well. Maybe if I can for the committee, the other thing I'd look at is on a national level. Before I do anything else, I ought to declare a conflict of interest potentially, which would be that I am actually also a general dental practitioner in Colchester on the Greenstead estate, so obviously directly related to the tendering area, but I don't think that causes a problem. My other role is I'm actually the Deputy Chief Dental Officer for England, so there is parts of the information that I'm party to that I can share with this committee that will feed into the work going forwards maybe. The two areas I particularly highlighted, some of the background, and many of the committee may be aware of a Health Select Committee report that was published last July, and further evidence has been given again to the Health Select Committee at the Houses of Parliament, in that the current contract is not fit for purpose, is the bottom line. So much of what Greg has been describing is how, as an ICB and as a region, indeed, we look to work in different ways away from where the contract is currently, which measures activity in the forms of these units of dental activity, so that we're looking at many of these other services, both in practices for priority access for groups and particularly urgent care, and for some outreach services, which will be preventive-based surgery services going out into local communities to serve them. With that in mind, a couple of other things I'd highlight is we're also reporting to the Essex Health and Wellbeing Board, and there is a team across Suffolk, North East Essex, Mid and South Essex, and Norfolk and Waveney particularly, that are looking to provide a regional solution in different ways, thanks to this opportunity from NHS England national team that have said actually up to 20% of any given contract can be flexibly commissioned to provide another form of service away from these units of dental activity. So that's very much what we're working to, and that's how we will progress forward. So I'll pause at this stage because there's been quite a lot of information for the committee, but obviously happy to help with Greg in answering any questions and queries, particularly that relate to the residents in the tendering area.
Yeah, thank you very much, Greg, for a very full and comprehensive report. And thank you, can I call you Nick or Professor? Nick, Professor Nick.
Nick is fine. Nick is fine.
And thanks very much for your supporting comments there. Members of the committee, three questions.
Is that okay? Thanks, Greg. It's just, you mentioned care homes, 6 care homes. Are those care homes across SNE, or are they based in tendering? Because we've got quite an elderly population. You raise the issues around people's health declining when they've got poor oral health, which we know. So I'm just wondering how that's panning out.
So yes, the 6 care homes are within North East Essex. I could have a quick look and let you know how many are tendering, but they're in North East Essex and not across the Suffolk North East Essex area. But what we've also done for the care homes within Suffolk North East Essex, as part of our priority access scheme, extended hours. We call it the Dental Priority Access and Stabilisation Service. pretty much does what it says on the tin. We're linking care homes with dental practices for in-dental surgery. So we're not actually yet going out into into care homes, but that's next on the list of what we could potentially commission in a similar model to some of the other ICBs within the East of England. And we do have regular communication and with the other ICBs, and also we meet with the chief dental officers on a regular basis and share the learning from some of the work that's been going on in other ICBs, so we can work together and be very proactive. If something's working well, then we take it on. For the health declining aspect, we know that one of the biggest reasons that I'm going to get this slightly wrong, I think it's 10 to 15 years, it could be 11 to 15 years, are admitted into secondary care is due to dental decay. That's the biggest reason they're admitted to hospitals. One of my objectives as part of our joint forward plan, as an ICB, one of our objectives is to see that decrease by, I believe, between 10 and 20%. I have to check the forward plan, but we want to see that decrease, and we think that by the prevention initiatives that we're running in Suffolk and the prevention initiatives that we're running in North East Essex, the aim is to see those dental decay emissions into our secondary care services decrease, because that's the gold standard that we really want to aim for. And there's a lot of willingness within the Suffolk and North East Essex providers to do more around paediatric care. It's just how do we fund that, and that's the conversation that we're having. We're looking at child-focused dental practices, which means that more can be done for children in specific surgeries, and that it will be kind of an enhanced service. It's not going to be kind of the level, there's kind of 3 levels. Well, normal practice is level 1, and then you kind of go to a minor oral surgery, which is level 2. This will kind of fit as a 1.5 type service, and it will allow for those children to actually be seen and treated in primary care instead of going to a specialist provider.
And I guess it's just a query really. Going back to care of the elderly, is there any scope for working with mouth care matters to ensure that people's oral health within the care home environment or in their own environment is maintained, and therefore they don't decline further both with their oral health and their general health?
Yeah, so mouth care matters is a national programme that has quite a lot of resources already available to care homes to implement. Through some of the programmes that have been running in South Essex at the moment, they are looking at kind of a similar way of supporting their practices, and that is something that we aim to replicate in the near future.
Brilliant. Thank you.
Councillor.
No, okay, just a quick one, really. Still getting people saying they put their doing self-dentistry on themselves. It's appalling. The question I'd like to ask is that there is a fully equipped dental department at the Mayflower Medical Centre in Harwich. I wonder why it is just been left there, whether or not you could consider perhaps opening up for people in desperate needs or something like that. Because it's there and it's fully equipped, never been used. And, you know, obviously people, there's 3 reasons. There's one, they can't afford a dentist because they need to go private. Secondly, there's no room at dentists around the Harwich area. No one can get on the list. And I think it's appalling really that there's this fully equipped dental department that's not being used.
So within Suffolk and North East Essex, we actually commission, as I mentioned, we commission 100% of activity is there to be commissioned, and only 75% delivered. So there is actually a lot of opportunity around recruitment and retention within the Suffolk and North East Essex areas. I think there are potentially chairs going empty in quite a lot of places across Suffolk and North East Essex. not just in Harwich. And it's, for me, I think the bigger issue that we face is how we recruit and retain new dentists within the area, so that it's actually all those dental chairs are used by the NHS, and how we make that as an attractive offer to dentists to come and work here. Nick, did you want to comment on that point?
Yes, thanks. Yes, I mean, in part it comes back to the attractiveness of, say, the NHS contract and how that works, and in part it's recruitment. We also know, Greg has alluded to, with the younger dentists, there's some explicit evidence now that younger dentists, as they qualify, do not want to necessarily work full-time clinically. So even over the last 10 years, there's been quite a large change from down to a one full-time equivalent to about a half full-time equivalent for the younger dentists now. So you're having to train 2 dentists to do the work of what one dentist was doing 10 years ago. And that's not critical of our younger dentists, it's just the generational behaviours and wishes. So we do know that we need to recruit dentists, and the NHS long-term workforce plan has said that there will be an increase by 2030, a 40% increase in both dentists and dental care professionals. So this is hygienists and therapists who do similar work to dentists, not the full scope of the practice that a dentist can do, but in many cases a large part. And we're fortunate to have the University of Suffolk and the University of Essex, particularly the University of Essex being in Wivenhoe, very closely related. So what part of our plan is to start recruiting those out into this area, the North East Essex area, and have them working out in practice. And by working in practice while they're studying, they're more likely to stay in practices. So the aim is to start filling these dental chair places, but as we do so, with a wider, more skilled team. So that if you go to the doctors, you don't see your doctor, you might see the nurse practitioner or one of the other team of the medical practice, and that's where dentistry is aiming to get to as well. So that gives us a little bit of scope for increasing what we can provide, and hopefully that will then start to fill these dental chairs in a meaningful fashion, giving the best practice to our patients. Hopefully that answers it. And going back to the mouth care matters, that's absolutely in Mid and South Essex what we based our care home plan on, is a training the train model vis-a-vis the mouth care matters and other nice guidance as well. So yes, again, we're following some plans clearly.
Has that been evaluated?
It is. It's actually been the work in the care homes. This is in Mid and South Essex. Is actually being evaluated by a research team at Queen Mary University London. So it's a bona fide research team.
Just a quick one. Could you then tell me what advice I can give to these poor people who are using pliers to pull their own teeth out? Can you tell me what I can tell them? Because I haven't got a clue at the time.
So with the extended access service that we have, we are asking our providers to prioritise urgent emergency care, and what we've done is we've updated our Directory of Services, which is the 111 and 111 online. Exactly what it says, it's Directory of Services. It allows people to kind of be signposted to the nearest appropriate service. And what we've done is we've updated our DOS, as we call it, to ensure that it returns higher. So the general advice that we give at the moment is to try and contact, if you do have a local dentist, contact your local dentist that you see. If you don't, phone 111 and they will do their best to signpost you to the nearest service as well.
Thanks for that.
Just a comment actually. Just reading this very small print here which says how we plan to make a difference. And the first line says the provision of behaviour management. I was just interested in that coming up under that behaviour management.
I'm going to look at Nick for this one. You okay to take this one, Nick?
Yes, very happy to. So behaviour management, there's an important piece of work that's going on. So what we know is that both the two major dental diseases is tooth decay and gum disease. Both are preventable diseases. They're non-communicable diseases, so they're not passed amongst people. And the main element to it is a self-care. But what we know is, and many people may have known, when you go to the dentist, what you usually get is told off like a school child, where you're told, go and do this, don't eat that, brush this, use fluoride, etc., which doesn't necessarily in itself get the sort of end result that we want. So what we're looking to do in this particular piece of research going on in 4 centres across the UK, Northern Ireland, North West England, North East England, and actually Essex, looking at a behavioural management technique that is working with patients on a direct communication basis of setting some simple goals that can be achieved over a longer period. And this is being evaluated and is actually being taken up by the National Director and supported by the National Director at NHS England. So we're looking again at new ways of working which has an evidence base behind it and uses what's called a negotiated basic interview. So it's an interview technique rather than telling the patients exactly what to do, but working with them to find out a better way of managing things. And there was a recent report in the British Dental Journal, which is one of the key evidence-based journals in the UK, around these personalised care plans. So the output from a consultation with one of the dental team members, the dentist or the hygienist or the therapist, is to go away and have a personalised care plan that sets for the patient what they can do in order to improve their oral health, and by doing so they will improve their general health as well. So somebody with diabetes, by improving their oral health, can improve their diabetic health sufficiently that they don't need the second oral diabetic medication that they may be taking. So that's our goal. Hopefully we will get somewhere close to achieving it.
And looking at the other side of the small print, whereas you're talking about children, presumably you're doing that with the youngsters as well, the prevention before all the major problems coming up with the sweeps and brushing their teeth and all those small things that can stop all this decay with young people.
Yes, absolutely. We're working, the actual study is working with 3 to 7 year olds, but that's because you have to, because it's a national piece of research, it has to have set parameters, but that piece will work equally for children, for adults, for everybody. So as the piece is proven, then hopefully we can expand that out to the entire generation gaps and populations.
Okay, thank you for that.
Councillor Alexander. Thank you, Chairman. I'm very impressed by the long-term plans that you have on the table and the way you're going about it. But we as councillors deal with things at the moment as they happen. This morning I had the very same thing as what my colleague here had. Someone couldn't find the dentist and they were in terrible pain. So long term, I believe it will work because you've got the right people behind you and the motive to drive along. So what about now, tomorrow morning, when people are in so much pain and are willing to extract an idea? What is the short term to alleviate this until the bigger plan clocks in?
So that would be our extended access service, the dental priority and stabilisation service. So we've got around 20 out of our 130 practices signed up to across Suffolk and North East Essex. And what that's doing is it's offering evenings, weekends and bank holiday services for patients that are the most in need. Primarily it's either through one-on-one or self-presenting at the surgery. But what that is doing is it's allowing for hundreds of people so far to get out of that pain. But beyond that, we're saying actually we don't want to just get them out of pain. We want to continue with that journey and make sure that their oral health is stabilised, that they engage with the dentist around their oral health to ensure that actually those behaviours that could potentially cause very bad oral health are addressed by individuals such as not brushing your teeth.
Sorry, sorry. Yeah, I'm really pleased with the answer which you said, and most intrigued about people are signing up.
one, how do you know who they are? More importantly, is there any in tendering?
There are some in tendering. The one-on-one are aware who they are and can signpost appropriately. I think from a demand management point of view, it is probably best that one-on-one manage that demand. Otherwise, what we found is that there's a significant amount of pressure then goes on to one dental practice or 2 dental practices or 20 dental practices that they can no longer manage. And for us, if I use Nick's practice as an example, they get up to 100 calls a day or 100 emails a day as well, requesting services. And it's around how do we manage that. And I will say that if you're in pain, you're not always the nicest person. I'm not the nicest person. And as an NHS, we do fully support zero tolerance, but there is an awful lot of negative comments that are put towards reception staff in dentistry that we do look to try and support where we can.
Just going to go back on the point. Yeah, okay, so we tell them to dial 111. Will they be treated when they get to be given a dentist? Will they be treated as a private patient or a national patient?
So DPAS is 100% NHS. There is some options when they're in the chair. I believe there's some legislation that says they can be offered, the NHS service or a more enhanced service, but DPAS is 100% NHS funded, especially in the evenings and weekends. That's all funded through us. Sorry?
Yeah.
I'm sorry.
You said it would be affordable.
Affordable.
Yes. Well, yeah. Yeah.
Is there anything that is specifically aimed at people with intellectual disability and autism?
There is, so the Dental Priority Access and Stabilisation Service also supports those with LD and autism. There is also, so those are for the kind of the mild to moderate LD and autism services where people can sit in a chair. I will use an anecdote if I'm allowed. My son's quite heavily autistic. He goes to a dental surgery and he roars at his dentist. The dentist sticks in the little mirror and has a look in his mouth while my son roars for about 5 minutes. But he's there and it works well for him. Where they need a different environment, so general dental practices can be quite loud, can be quite busy. We also have community dental services that provide specialist care to patients within Essex, and there's an organisation called Community Dental Services, but it also can be kind of broadened into actual community dental services. So community dental services are also provided in Suffolk, but that's by different organisations, community dental services. I won't go into it.
Okay. Councillor.
Yeah, if I could just mention, I've been quite impressed with listening to what you're all saying. Being a person that goes regularly to the dentist twice a year to have my teeth cleaned and done the dentist messing about with me, so I'm very impressed with that. And I learnt my lesson when I was 18 and I had terrific pain in my mouth, and I went to the dentist ever since. So I've learned from that lesson. But what I like is the idea of putting something within doctor's surgeries, because in our area, especially rural areas, from my perspective, Great Benton to Brighton is where I go, obviously, as you know, but that's where we go. But the older you get, it's not so convenient to travel such a distance. So for the older folk, of which we have quite a few within the villages, that's going to be a very useful area to get practice with. Because I do notice that obviously through the COVID period, the population seemed to drop down considerably. So I should imagine that things have been quite active to get them back up again. There was something else as well, the age bands, and that was an interesting graph there for the age and what numbers are going there. So thank you for that. But it's all something that we can get into our own minds as well, as being counsellors, that we know that we've got something to say to people if they've got
a problem or a query. So, but yeah, I don't think I've got much more than that to say, but I just thought I'd just mention that. I do have concerns regarding costs because of the dentists that now have been NHS are now going out to private. My own dentist is actually doing that. And there's going to be a little bit of a situation, I think, there to start with, and then numbers may drop for a while. But that is a concern that we've all got to think about. So we'll stop there now.
So the NHS is based on a private NHS model. As I said, we only funded to commission about 50% of the service. We are looking at a very short-term commissioning opportunity as part of the NHS National Recovery Plan. We're one of the, I won't say 11, but it might be one ICBs within England that will be commissioning a mobile dental resource. What we again want to do is manage that demand because they can only see around 10 to 12 patients a day. So it's actually quite a limited resource that we have. But it will be looking at how we can support some groups, some specific groups in more rural and coastal areas going forward. But it is going to be a short-term service that will only see a limited amount of patients. What we really want to do is actually increase the delivery of the services that we have now. So we have an opportunity to rebase some contracts where they haven't been delivered the contracts for the past 3 years. We can go and say, well, actually, we can say we'll have that activity back, and then we can go to the market to say, can you deliver that activity? But we will also want to work with them to say what is realistic we could achieve in the next few years, so we don't, so we can support them as well going forward. But there is that opportunity to withdraw some of the funding from some of the current providers that aren't delivering, and there's a few big contracts in the tendering area that aren't, and then put that money out to the market to say if there's somebody that can come into the tendering area to provide general services.
A couple. I'm sorry.
Just general comments. As a council, we receive information and data from health projects on a regular basis, and that lists all the sort of areas of concern and the inquiries coming through from local residents. When you last presented to us, about 16% of our population queries were about dental provision, and those were the areas where queries were coming through and the areas of concern. That's now gone down to 3% over this last 3 months. So I really wanted to say well done to everybody. It's definitely going in the right direction. If you look at that health watch data and you see that trajectory. Thank you.
It is, but there's a lot more to do and a lot more it wants to do.
And you touched on staff recruitment. What's the average training time?
Nick, do you want to cover this one?
Yeah, certainly. So there's across the dental team. So a dental nurse takes 2 years to qualify. A dental hygienist then takes a further 2 years to qualify. Although you can go straight into being a dental hygienist and not have to be a dental nurse for, first of all, at the University of Suffolk and University of Essex models. Then if you want to become a therapist, that's 3 years to qualify from the beginning. And if you want to become a dentist, then you do 5 years, and then you have to do a further, what's called a foundation year after you've qualified in specified training practices in order to then be able to work under the NHS on what's called an NHS performer.
So, picking up on the flexibility thing, I think it comes across as quite positive that people can move within the industry. Have I got that right? Then they could do, they don't want to go in one direction. They can actually be the nurse or the hygienist or stay on to do the full course. And obviously that has been would you say that that is a continued success?
Yes, that's right, and there's a few that are starting this, Essex and Suffolk certainly, and University of Liverpool, and it's called an escalator. So you can go up the escalator but choose to get off when you want to, and that's certainly the new way of looking. So, and also at each of those points, the individuals, what we call dental registrants, have certain abilities, so there's an awful lot that they can provide at that level. And what we know is, we talked about the prevention piece and behaviour management. Now, that is at the level of the dental nurses. So you don't have to get right the way to the top of the escalator. So really what you need to do is have a large number working at the dental nurse and the hygienist level, and the fewer at the dentist level, because if you get the prevention right, then they don't need the more advanced complex care in all of the occasions. In fact, hopefully that will get less and less as we start to turn this model around.
Yeah, that's a really good point. Really good. So, just get it straight in my own mind. So there's lots going on, and I think you'd be congratulated in your performance in the last year since you came before us last year. So where's it all? I'm not telling you, where's it all controlled from? So where is your actual base in this area, or is it different places?
So Suffolk North Essex has, ICB has 3 different bases. One is based in Colchester, one is based in Ipswich, one is based in various Edmonds, which are our 3 biggest towns.
So that's like the operational.
Yes, that's where the ICB, our ICB centre is Ipswich.
Okay. Is there any mileage then in doing maybe, because obviously you come to us, maybe is there any mileage in the committee going to those centres just to get a hands on at the what I call the cold face?
So the ICB obviously is more kind of a commissioning and administrative function.
Yeah.
But if you would like to visit some practices, I'm sure that we could arrange for you to go and see some of the practices within Suffolk and North East Essex and have some conversations with people.
Okay. Yeah, I think you'll people on that soon. Any other questions?
Just on that point, there are some really amazing dentists within North East Essex, so within Henry and Colchester, and I phoned up and I met with a number of them in the 6 months that I've been here, and they've got a real passion for public service. And there are some that obviously, are struggling, we're looking at how we help them, but there are some that are meeting their targets and are delivering everything that we would hope them to do. So I'm sure they're delighted to.
Yeah, that's lovely.
Frank, before you finish, there was mention of using university students that sort of in training, putting them in practice. When is that likely to start?
So there's been a lot of discussions about that. I think at the moment it's still in scope and phase, so I wouldn't probably want to put any time frames on that, but I'll defer to Nick with his Deputy Chief Dental Officer, Patrick.
Yeah, I mean, the placements, there are different ways of doing it. There's a number that we're looking at. At the moment, the University of Essex already has some students in placements, and some are actually in the tendering area, and some are certainly in the East Colchester area as well. So we have those placements already there. But the main issue currently is around the funding of how those students are actually funded to be in those placements. But that's a current national piece of work that's looking to change that funding around. So, as Greg said, although I wouldn't suggest we sort of postulate what that may be, I think sufficient to say it will be in the very near future, because certainly the national team are minded to, unless we change around the commissioning model to encourage that sort of placement, then we are going to carry on struggling because we won't have the workforce that we need. But that will also be driven by, as I said, the NHS long-term workforce plan says that 40% more places for undergraduates in the next 3 to 5 years. So they will have to go somewhere. So we will have to make places for them, and therefore that will drive them out into placements out into primary care practices, including across North East Essex, because we've got a good dental undergraduate provision there for hygienists and therapists at least. And our aim would be to get some dentists into that area as well, but that's a slightly further, more a few years down the line piece of work maybe.
Other one just about the, you mentioned the, I think we were not quite certain it was 20%, but 20% decrease in child admissions, I think.
That's what we're aiming for.
And over what period is that?
So I've got 4 years left, so it's okay. We put it into our joint forward plan last year as a 5-year target, working with our public health colleagues in Essex County Council and Suffolk County Council. So there's four years left for us to achieve that target.
20% reduction.
That's what I would love to see.
And that still leaves 4 in 5 still going to, you know, that reduction. It still means that 4 of the 5 that will still be appearing at hospital, doesn't it?
Absolutely, but then that's the next stage of the target going forwards. So personally, I'd like to see absolutely nobody go into hospital because of dental decay or dental pain. But I think we need to we need the help of all services within Suffolk and North East Essex to actually make that achievable. So everything from supermarkets to education to mums and tots groups. We just need everybody to be involved in actually promoting good oral health, because it is everyone's business. People are off work because of it, people are off school because of it, they miss education days, and it's highly preventable. So it's just around how we change that behaviour, around ensuring that people can actually and have access to what they need, toothbrushes and toothpastes, to ensure that they have good oral health. And a lot of what we're discussing here today is actually all decay that is and gum disease that is preventable.
One of the suggestions that came out the last time you were here was basically working with food banks and trying to improve that. Has anything been able to be taken up to sort of make sure that toothbrushes and toothpaste make that happen?
Yeah, we've got 1,500 toothbrushes, adults, older children and younger children, into the local food banks and community supermarkets. This last year, and we'll be doing the same this year, 800 toothpaste last year, 800 toothpaste this year, and we're also offering training through one of our community providers to all of the food banks food banks within North East Essex as well.
Sorry, it's really wrong one. What is a very busy food bank and we've got access to all of that, so that's what I'm thinking.
It makes me smile that it all works as planned, because it's lovely to see that happen.
Nick, did you want to have a closing remark?
Final remarks, yeah, maybe going back just to some of the councillors were saying about their residents and not being able to access services. And Greg has been talking about the dental priority access and stabilisation service. So just to make clear, it is an NHS service and it doesn't look at just bringing patients who've got urgent problems. The stabilisation part of the name says the patients come in, they have their initial problems resolved, and then they go on to a stabilisation of the current disease that's in their mouth. And that's some of the problem that we're suffering, is that historically those patients have quite a lot of disease in their mouth, and the way that the original contract works, it wasn't attractive to take those patients into practices. By using this access and stabilisation service, it actually facilitates better care by the appropriate people. And looking at that, the one in Suffolk North East Essex has just recently started, but to give you some idea, there was one in Mid and South Essex that started in September of last year, and the one in Suffolk North East Essex looks very similar. The one in Snee is starting going. The one in Mid and South Essex has now seen nearly 10,000 patients since September. So it will grow. It takes a while to grow, but there are good opportunities, and we would very much hope that the Suffolk North East Essex model follows in a similar pattern, and I can't see why it wouldn't. So we've got a lot of learning to do, but as a dental profession we're working together, so we hope to come back and maybe to present to everybody, and in a year's time we may have an even cleaner and better picture than we do now. But thank you very much for the invite.
Thank you very much. I know Greg has got a big weary way back to Suffolk.
There was just one point I wanted just to add to Nick, is that actually we do collect data on attendances through our extended access scheme, and actually 15% of our appointments that we commission are not actually attended by people that request it. So it is really a plea to say that if people do have dental appointments, please do make sure that we attend, because there are, I think for other services that Nick has run, it has got actually higher than that. And what I really do is encourage people, if they do have NHS appointments, attend them. And if you do need to cancel, please do so in as much advance as possible. Obviously emergencies happen, and we know that, and that's absolutely fine, but for 15% of people that are meant to be in pain, not to attend their appointments, it's really about trying to support them, and so I would just say, it's really important to make sure that people attend appointments, not just in dentistry, but obviously as the head of dental, I will say for dentistry. Thank you, Chair.
Thanks very much, Greg, and safe journey.
Thank you.
Thanks.
Thank you.
And thank you. Really good. Thank you very much.
Thank you, everyone. Thanks. Good night.
So we move on to recommendations after the presentation to Cabinet. So is there any recommendation?
Keep in touch with them to catch up. Is that possible?
I think that what we can do is if it's your wish, we can put into sort of pop for the work programme for next year that you might want to come back and have another look in a year's time at what's happening with the NHS dentistry. So if that's your decision, there's quite lots of nods around the room, then we can put that into the long list that you will obviously then at some point then determine what goes in your short list.
This makes sense to follow up, doesn't it? We need to follow up, don't we?
We've seen an improvement, but that's on the back of COVID and everything else. If you give it another year, that should stabilise, shouldn't it, and give you a better picture.
And what about visits then? If they've got already in placement incentive, then it might be an opportunity for us to do what we did at the police station.
I would agree, but I felt that they didn't really want us to know where their special centres are, because it would be very tempting to use that information for your residents. So I feel, and I don't think this is being secretive, I think it's being correct and professional that we don't know where they are, because it would be quite a temptation to say, well, actually, but maybe just a general practice that's part of this new system that they're rolling out, possibly. But I don't know where a benefit to go and sort of lurk around a dentist. I hate dentists.
We all do, yeah.
That's just a feeling.
Yeah, I'm
you know.
just thinking if there's anybody trained in it, or hygienist or whatever, and they've already in placement, and if it's linked up to the Essex University,
Yeah.
then maybe we should
Yes.
go to Essex University.
Yeah, maybe to encourage them to go out to the room
Yeah,
and stay. Yeah, I think
I
that's,
was going to say that.
yeah, I think that would be great.
That's you put into the work programme as a potential item.
Yes.
And we're to include the visit.
I think that I was going to say that myself, that's why I think it'd be better playing to Essex University.
Yeah.
Find out how they're trained, or where they're going to go, rather than going into a dentist. Where I can't see the point.
No, okay.
And if, like through the chair, sort of being able to talk to the students and finding out what would attract them to stay within the NHS,
Yeah.
just for our information, rather than as soon as they get qualified, they go off and stick to private practice. And I guess it's money, but it might not be. Some people really are dedicated to their craft and their trade. But it would be nice to see what tendering could do to sort of encourage new dentists to turn up, pitch up, live, bring their families to tendering and really create a dental culture that's attractive, because they generally
Well, still want to put a recommendation in.
yes.
So, could we not then make the, as you say, build this ethos or into, so how
Just tell
do
them how wonderful tendering is. And
yeah, so
and
how do
to
we get
come
that
to
then?
tendering.
So how can we say a recommendation to Cabinet to actually put that in as if it up with the corporate plan or after the corporate plan? Would it link up with? Let's just make a positive recommendation.
I think if you wanted to make a recommendation to Cabinet, it would be around the positive news that has been provided since the ICB took over, and to welcome the continuing partnership working that exists between the ICB and the Council. So we can fashion a recommendation around that, if that's your wish.
Yeah, sounds
Yeah,
good.
Yeah.
So we was.
And then,
That's exactly what I was going to say.
I know that's exactly what you say. Yeah. So, and if we put into the work programme as a decision of this committee that you will put in as a draft item this, and that potentially that could include an element of the inquiry that would mean you going to Essex University. It may be that the coastal communities unit there as well may be an opportunity to sort of link up the two and think about how the two could potentially assist.
You know, I won't be sitting here, of course, by the time we get to where we want to go. But I do recommend that we keep on with this. This is one of our biggest problems, even in St James. We're trying to find a dentist. I also think that going to a practice and telling you exactly what the practice wants you to see, rather than a bit like an Ofsted report, the school will only polish up all the notes reports and get everything ready. I know I've been there, done the t-shirt. But if you go to a seat of learning, like in education or faculty, they will then show you what is happening on the ground,
As it is.
rather than as it is, rather than make it up.
Yeah.
I think it's an excellent recommendation.
Right. Sorry. Is there any mileage in that we could extend that recommendation to include something around the education of them safeguarding to care homes? Just because I think we focus so much on children, and rightly so, but actually lots of people end up going to hospital because they've got all thrush, they're not eating, people don't understand those really simple things that we put in place to prevent that. And they said they are linking into the equivalent of healthcare matters. I just wondered whether it would be, I would be personally quite interested in seeing what's going on with care home.
We could do that as a part of, you know, the live name, where we get into care and see what care homes do provide.
If you did, remember you've got time, you're going to be looking at this next month about working out what's going to go to your work programme, and you do need to prioritise. There will be things that you may be thinking here today that you definitely want to see in the work programme, and they might find their way into the work programme, but there's a process to go through. And I think, you know, you may, as that process goes through, identify that it's not just the university that you want to go and hear from the experience of the students, etc. You might want to hear from those that have been on placement and their experience of it, as well as the work of the ICP with individual care homes and what care homes have found has benefited them in relation to that oral hygiene. So I think we can build that into a potential item that will come back to you, and you'll determine whether to actually put that into your work programme.
You okay with it?
Yeah.
Okay. Right, we're now going to move on. So thanks so much for everybody's participation in that. I thought that was quite positive, thank you. So, now we're going to move on to item 7, which is the final report of the mainstream community transport agreement. So, this was a task and finish group, and it's been quite a nice journey on this task and finish group. We started off, and Gary may remember, where we were shot down from the community transport from here to Colchester, taking in care centre and also the general hospital as well. We were quite impressed.
Chairman, just for councillors' benefit, it starts on page 85.
Okay. So, yeah, we started off with the community transport, and moving through, we went to the transport and community transport at the end as well. And there's quite a few good things which were brought up along the way. Especially with the community transport, if you remember, the guest speaker at one of the AGMs was I can't think of the gentleman's name now, he was involved with getting the funding for Clapton School. And of course the spin-off of that has been that the community transport used to get people from Clapton to Colchester has been actually taken over, if you like, by all of the 200,000 procedures which have been done at Clacton in a year, which is going to go up to 250,000. So instead of taking people to Clacton to Colchester all the time, you know, people will come in locally. So there might be an opportunity there as we push on to use that surplus of transport on there to bring actually people in from the other outlying districts of Tenbury, Harwich, and Brightsea, Mount. So I think that's going to be quite a nice one, which was probably a bonus to what we thought. And then obviously we talked about coastal towns as well, and transport through coastal towns, and obviously the lack of subsidy for the under 16s on transport as well, to get them into the right place at the right time. And that's obviously to access education schemes and also grants to actually get people into full-time employment as well. So I'd just like to invite Lee to come in on the report, because obviously
just before you do, can you just formally move the recommendations on page 88? Jim?
Yeah. Can we move recommendation on page 88?
If somebody can just second that, that would be helpful. Councillor, will you just second it?
Okay.
Thank you.
We'll go with that.
Yeah, all right.
Over to Lee.
Thank you, Chairman. Yeah, I was just going to note on page 94 there's a chart which is come out relatively small in the final edit, but I just wanted to explain what that was, so I think that does set the context a little bit for this report, and it's a national survey of households with access to a car or van, and I will describe it because unless you have a particularly strong magnifying glass you may not be able to see the detail within it, which is that it sort of starts from the last sort of 50 years and starts from the 70s and comes through to today. And what it's showing is that although the number of households with a single car is relatively flat, which is the orange line that kind of goes flat along the top, the number of households with access to no cars, the green line that's come right down, is 22%, and the number of households with access to 2 cars or more has gone up from sort of 8 to 33%, I think that is. So effectively the point about the public transport system is that over the last 50 years the private transport system has massively expanded. You know, lots more people have access to cars and lots more people have access to 2 cars than 50 years ago. Obviously the country's also got wealthier over that 50-year period, but the kind of the public transport system is operating in the context of the fact that lots of people are taking cars rather than buses. So that's just, I think, an important bit of context just to note for the report. And actually, tendering has 20% of households don't have access to a car, so it's like the rest of the country. It's roughly similar to the rest of the country, although that's different, obviously in different neighbourhoods and different towns. And I was just going to highlight a few of the findings, if that's all right, Chair. You know, you've already picked out the importance of the issues of subsidy that are in the report. You've highlighted a really important point around getting services based in coastal towns, like the Clacton Diagnostic Hub is a really great example of that. And it talks about the community transport service and that it's providing a really good service to its customers, although I think it's still oversubscribed even today, isn't it? But they're doing really well. And I'm sure it could expand if there are opportunities to do so. We didn't really engage so much, I don't think that the committee didn't engage so much, the Task and Finish Group, sorry, with the rail services. So just to note that this report is mainly drawn from kind of public information that's been included, because I think rail is important. And one of the key findings is really from Clacton about the hourly service during the day, and the aim to kind of go to a half-hourly service. So one of the recommendations around kind of increasing the frequency of the service. From Clacton, I think from Harwich there are more regular services, although obviously, as we all know, they're branch line services, and it's only really Manningtree that's got the mainline service. And I think the other point is just noting that a lot of the transport providers and ECC as a funder of transport services, everyone's trying to do their best. So even though some services are shrinking, particularly bus services, and you've kind of seen some of the bus services, for example in Clacton, routes being closed, and some of the, either the investment from the county council or the private sector providers, that's sort of on the basis of viability and not on the basis, as we know, it's a privatised system, and where routes aren't viable, they've closed. So, and then finally, particularly around the bus network, as I say, we know it's shrinking. We know that people raised issues of frequency and reliability, but you know, engaging with the bus providers, I think is to be a positive thing, and I know that they're looking to make efforts to improve the service. So that's just to highlight the findings that are in the report, back to the full committee from the task and finish group, and the recommendations broadly reflect those findings and have been moved. And just to point particularly to the idea of recommending holding a summit with local transport providers, which would give the opportunity for the executive and potentially the committee members to engage with those bus companies and rail companies to kind of really push further, as you've already started to do with the community transport in terms of those engagements and conversations.
Thank you. Any questions? Thanks.
Recently, about a week ago, that's nothing to do with this report, but I think I have an update on it last. The number 2 bus service is no longer to be after July.
Yeah.
The number 2 bus is the bus that takes a lot of elderly people to get their shopping. They go to McDonald's. I understand that there's nobody else coming to tender for it. Have you got an update on that?
I don't have an update on that, but we can ask BCC for an update on that and share it with the
Would you
committee.
mind finding out?
Yeah.
It's very important to the people that need that bus.
Yeah.
Thank you.
I think Essex County Council have done their own transport strategy, haven't they? I think that maybe, you know, because we had the conference at Sunspots in January, which I attended, and they've done their own strategy and also done their own consultation.
Yes, exactly. There's Essex County Council are working with different districts to develop a sort of a longer term transport strategy as part of their long term. They're redoing their Essex-wide strategy, and those conversations are starting with tendering district in this year during 2024. And having this report and having the recommendations within it is an opportunity to feed into that piece of work, so that as they develop that strategy, these recommendations can be taken into account. I mean, I'm not saying they'll sign up anymore, but they can at least see them and take into account.
And I think that's probably the priority for us to do these recommendations on all task and finish groups when we do it. So we can actually, it's evidence-based, so we can actually push on. And I think that probably on transport, there's lots of different strands to it. And I think the phrase I always use, am I looking for the Holy Grail? Because you think that there should be an easy answer to it all, to liaise with all the different strands, but obviously the same as everything, it's never as easy as what you think. But I think this task and finish has really set the scene for us. And now what we've got to do as a committee and those that come after us is to say, let's keep the pressure on. Let's set the objectives, set the recommendations, so that we can make real progress. To highlight them, really highlight the ones that's there, you know. So we need to get somewhere along the line, we need to come up with something to say, you know.
I know that they've got a profitable, which I'm private, they're a private organisation.
Yeah.
But it really doesn't help that many people that desperately need that. They haven't got a car, they can't drive.
Yeah.
I mean, thinking that they would be isolated in their own house is appalling, really.
Yeah.
And the feedback I got from yesterday was that there is no other contractor coming in for that contract. But if that's the case, something's
Yeah.
we must, because we can't allow that to happen somewhere.
So, the first recommendation is on page 88, so I'll move all the recommendations, but I think the A on that one will actually fit in to what you're saying, Jim. I would say, you know, to hold the summit with the transport providers, and then we can actually bring up all of these issues and the problem areas. So, we'll move recommendations on page 88. Okay. Thanks very much.
Chairman, it's just probably worth recording in the minutes the thanks of the committee to those members of the task and finish group for their efforts.
Yeah, and especially to
The members of the task and
and
finish
also
group.
the officers
All right.
who have given us great support. Could we have or...
Yeah.
Thanks, Sharon.
You didn't live on a bus, did you? On the way? Thanks, thanks. Okay, we'll move on now to...
Agenda item number 8, which is education. Councillor Bauer,
Chairman, just to say to councillors, this came out as a separate document, so hopefully you've got that.
Over to you,
No, I haven't.
Okay, so this task and finish group focused on 2 areas within our remit. One was attendance in schools, and the second was mental health in our secondary schools across Kendrick. We early on set up a number of focus questions that we wanted answered. For attendance, there were questions like, do our schools meeting the 95% target for most of their students? What's the main cause of absenteeism in school? What interventions do the school have in place, and are there any barriers to that intervention? Similar questions for mental health. We asked schools to describe the situation for young people in school and the mental health demands. What could schools provide? What was their need? What barriers were in place for that intervention? Task and Finish group thought it was really important to visit these schools and to meet the pastoral leads face to face. Those visits happened in January, March 2024. We pulled our data very recently in April and put our conclusions in place and recommendations. 4 schools across Kendrick were very keen to get involved in this. And our headline outcomes, I'll pick the headline figures out for you, were as follows. So we concluded that schools are struggling to ensure that good attendance levels, 95%, are met. It's 95% is very significant because that's considered a good level. For every 10% that's dropped below 95%, at Key Stage 4, that's considered to be a lost grade. So if you're a level 7 student and you're pitching in at 85%, that 10% drop may cost you a level. That's what the statistics tell us. So headline figure number 1, that schools are struggling to maintain this 95% figure. Schools are using a range of strategies to improve attendance. The main cause of absence, other than physical illness, is mental health, and that links with our second focus question, comes up shortly. Mental health need in secondary schools across Kendrick is very high. The mental health demand has increased considerably since COVID and shows no signs of abating. The mental health needs of our young people across our Kendrick secondary schools have become more complex. External waiting lists for external support are very long. Those headline figures are very much in keeping with national reports across our schools in England and other regional reports. So those issues that Kendrick secondary schools are facing are in line with schools across the country. What this report teased out were 2 things in the conclusions that are not regular across lots of other reports, and I'll highlight those 2 things to you. The first is that the point was made was that mental health and needs of young people become more complex, and what this report appears to suggest is that teaching staff that once provided support at a level are now more reluctant to do that because the needs are more complex. Teaching staff like heads of year, like form tutors that might have engaged and put a level of intervention in are now not doing that, and that might explain why the mental health figures are higher and are not abating. So the report teased that out, which was was very interesting. The second thing it teased out was that school curriculums appear to also be contributing to negative mental health amongst the Key Stage 4 students, the GCSE students. And the report suggested that the curriculum is very narrow, that there is less alternative curriculum, that most students are sitting GCSEs, and the alternative curriculums that might have existed 5 and 10 years ago do not exist now. And all the schools mentioned the pressure on them for grades and levels, and that of course is pressure that's cascades down to students. So those two things in this report are slightly different to other regional reports and the national reports that come out over England. The one thing that was also clear is that our two focus areas were very heavily linked. That a significant contributing factor to increased absenteeism are the mental health issues faced by young people. So the two things we investigated link very closely. So they were the headline results. You can see the recommendations in your pack. I'd like to just maybe pick up on two of them as a really good and positive way forward. Number one is to champion where possible local mental health support for young people. There are groups out there that are offering very good services that some schools haven't picked up on. And to highlight that, to champion that would be really important. Because some of the schools mentioned support that others didn't, and linking that up and signposting that would be a really good way forward. I'm not suggesting for a moment that there appears to be enough support outside there to meet this gap, to close this gap, but there is support out there that some schools haven't heard of, and schools that this council could obviously support that this council could also support in the future. The second recommendation that I'd like to highlight is number 6, which is tendering district councils primary wellbeing hubs, which are a fantastic blueprint in how for primary school children to manage their mental health. And obviously, if young people are empowered to manage their mental health at a primary school level, then lots of the issues we're seeing in secondary school may be reduced and may not be there. So that blueprint is a really important one to shout from every possible rooftop out there. So all of the recommendations are very good and useful. I've just highlighted 2 because I thought I found them the most powerful. So that is, and very important, is this couldn't have been done without councillors going into the schools and meeting pastoral leads face to face, getting that data back quickly, and it certainly couldn't have been done without the officer support. And I thank the officers for that, because that guidance was absolutely crucial at times. And it was a very enjoyable process, and I thank you for that. That is the report.
Well done.
Thank you.
That's fantastic. Well done.
Can I just
Yeah.
just say something? I have to apologise because I couldn't obviously get on time, but for other reasons. But when I did, I thoroughly enjoyed my visit. I really did. And I had such a charming young man. He was really nice. And he was very helpful. I mean, when we got to this primary wellbeing hubs and what have you, I mean, we've obviously worked with it with the primary schools. And if this can come out into the secondary, that would be brilliant. I'm sure it will probably, honestly, I expect officers will probably agree with that one, but those that were involved at the time. But no, I was really, actually, really pleased that we were given the opportunity to go around and speak to everybody about, people.
I think that, again, this gives us a really good basis, and I think our objective as a committee should be now is to how do we push on from that, using that as a reference, and then and who knows what we can achieve, because my view is that you looked at things from a slightly different way to what was ever been done before. I think it's first class and well done to everybody who's participated in all the task and finish groups. Bill, did you want to?
Yeah, I was part of that because I must say, visiting the school, I found it to be quite an education myself. They were, the school I visited was very helpful. If you didn't know a question, you would have found out. And it was very helpful. What I would say is maybe not next year, but maybe in a couple of years' time, we did a similar thing to find out if it's improved or declined. And I think it might be a good idea to revisit that, not this year, maybe 2 years' time, just to find out whether we're still in the same ballpark. I think it'd be a very, very interesting thing to do.
And
Okay. Yes, I'm interested in obviously the mental health hubs. I help run a very successful youth club on a Tuesday night. We can have anything up to 80 youngsters from the age of 7 right way through to 14 going through. The person that oversees it now for me, Kevin Smith. I know some people know of Kevin. He's part of the crisis team. He also goes into schools and he does a lot of mental work. It is a major, major problem out there, mental health, as you have just identified, and it is getting worse. We have noticed over the last 2 years that the youngsters that didn't go to school, we've got 2 or 3 girls that weren't going to school, now are in full education. They like the youth club, they like the Wednesday night fitness group, they like the hub on a Saturday afternoon where they can come and chill and they feel safe there. And they often offload their little problems that they have, and believe me, they have a lot of problems. On these hubs, how many are they going at the moment? Are they in junior schools, are they at senior schools?
The hubs in primary schools,
Yes,
but the blueprint we
primary.
follow is something that can be extended to primaries, but also there's lots of good practice in there that secondaries could, not that they're not doing some of it already, but could certainly pick up on.
So it's something that I know this council are aware of it, obviously with the suicide rate, etc. And I know at length I've spoken to John about things, and I think if anything this council really, really should, you know, if we can do anything out there to get on board and address some of these huge, huge issues.
But what you said, you highlighted successes. And you know, going back to what I said, that this is the basis for what we really push on with that in our own wards, but also to as a whole, you know, and it just shows you what you highlight, what can be done,
Yeah,
what can be done. Yeah.
It's worth mentioning.
Oh, sorry.
No, I was just going to say it's worth mentioning how much the well-being hubs have spread now through Essex as a whole. And it's just proving that they've proven that it's working extremely well. Thank you.
Laura, sorry.
It's interesting, this interested me, but this fascinated me. And I can see Anastasia laughing as she knows why as well. It's a public document, and I was a member of the public, in effect, and so I'm not a member of this committee, so I'm seeing this for the first time from your eyes. And the one thing that blatantly reverts to all the time is the mental health section. And this is alarming, because if you look at where we are now, what is in our schools today are the torchbearers for our future. The engineers, the doctors, the teachers, people who empty dustbins, sweep the roads. Every piece of that is intricate to the way our system is built together. Looking at this, I see this, one of the things that I did notice that was missing, if I may, is that the barriers for learning, there was no address to the parents themselves. There seems to be a culture in, not across, but in small minorities, very small minorities, where the parents do not seem to take any logical or even any interest in where their children are going. I know this because I deal with those guys in another place. My wife works at Compass School in Thorpe. As you know, you go in and lock the door. Okay, so it is becoming a major problem. But you've opened up the can of worms. This has opened it up for us to read. And as a member of the general public, I'm quite alarmed at what you have revealed to us. So I thank you for that, but I also know that we need to do something about it. And if we don't do something quickly, we're going to be in trouble, especially with antisocial behaviour and other associated crimes that we see, minor crimes, but nevertheless antisocial. So again, thank you for this, and I certainly will be going with your recommendation.
That's great.
I just want to come in and answer a number of the comments and questions raised, particularly about the wellbeing hubs. So there's 33 wellbeing hubs now across North East Essex, 30 in Tendring, and every school in Tendring has had an offer if they wanted to have a wellbeing hub over the past few years. Majority of schools work with us and have a wellbeing hub, but for some schools they've been able to take up the opportunity because they've had other priorities, because every school that has a wellbeing hub has to contribute financially as well. And the majority of them use their pupil premium, and sometimes schools have other priorities for that pupil premium. So for example, it could be like teaching equipment or something like that. But in terms of the wellbeing hubs and where we have them, if there are spare places, then they're offered by the schools as well for pupils to actually join. So I think there's a good system set up now across Tendring, to provide for young people. And once a young person is engaged with a wellbeing hub, it's not just support for them, but it's support for their parents or their carers. So alongside what's happening in the after-school wellbeing hub, the parents and the carers are given support around sleep hygiene, nutrition, behaviour management, and I think behaviour management is seen to be the most popular course that parents have wanted to attend. We've now got a full evaluation from the University of Essex, and Rebecca's been leading on this piece of work over the last few years. A full evaluation of the wellbeing hubs and their success, and that's looked at children's progress, the home environment, the whole family unit, and improved communication, things like that. And it also has looked at the culture of the schools, got feedback from teachers as well, because that's been really important for us to see, the impact is that made in the schools. And the majority of teachers are saying that's to reduce the barriers to learning. And we actually can now start seeing, if you look at our attainment levels, particularly that lower age level, Key Stage 1 and Key Stage 2, and making significant improvements. You can start seeing that coming through. We also mentioned about secondary schools. When it comes to secondary schools, it was a government initiative, probably started about 5 years ago, that every secondary school should have a qualified mental health first aid app. So that's a national scheme. Everybody who works in our primary hubs, whether that's a teaching member of staff or support member of staff, has to have that training before they're actually allowed to be part of the primary hub. I think you're right in terms of signposting. I think, we've got some great support partners out there. I'm thinking of Mind, that operates in a number of our schools, Team Talk, and aerospace and Paris, that they provide support to other parts of the district. So there's a great network of support, and it is just that signposting, as you say. Thank you.
Can I come back to that? The schools with hubs, have they seen a marked improvement in attainment because they're that?
I won't say it's a huge improvement, but it's definitely on the right path.
Right.
And particularly at the Key Stage 1 and the Key Stage 2. And you can just see that trajectory. I hope over time we see that as it's going up the levels into secondary school. Because if you give the children at that early age, that's unacceptable skills, and that's what we call it, a unacceptable skills, so that they can overcome, sort of issues and worries and express their feelings, and it's improved their communication, and parents have found that it's improved communication considerably at home. So the stats and the feedback we've had from the University of Essex, it was just presented last week at our Community Safety Partnership Health and Wellbeing Board, and that was really, really useful for us. That's also going to be presented Essex-wide, so that's going up to the Essex-wide Health and Wellbeing Board as well.
Rebecca, I know you were involved with the wellbeing report. So John, today, you know, health, we talk about health and community, so I think this evening we've had a broad spectrum about health, dentistry, and also community and schools and transport. So is there anything you want to add to
My only reflection over the whole evening was something that Greg Brown said, and he made a comment about oral health is everybody's responsibility. I think that actually applies to everything we discussed tonight. There really is a contribution we as a council can make, and our partners can make as well. And it's about how we work together to try and get a greater result than we can do on our own. So I think there's something about partnership like that is crucial.
And of course we are very fortuitous because we just made a decision about putting press releases out on behalf of Scrutiny. So we've got our communications team in attendance tonight, and I can see James scribbling away manically there, so hopefully we can build on the two press releases we've already done for Scrutiny. So we look forward to the next 3 instalment. Okay, we're going to go now to the last item, which is the review of the work program. What is the recommendation?
Yeah, if you can, that would be helpful. So the recommendations were moved. If somebody could just second those. And then if normally, could you just show your agreement to that? Thank you. Wonderful. Thank you very much.
Now,
item 5.
Item 5.
So, Sharon, the report is there. It's your standard report. So it does cover the work programme from this year and your progress with those various inquiries, including the transport and education ones that you've received the reports from the Task and Finish groups this evening for. It also sets out the recommendations monitoring, so the report back from Cabinet on the decision there in relation to missing. And at page 49, it deals with the scrutiny of proposed decisions. So those are there. Just to pick out on page 33 of the report, it sets out that there was a meeting involving the chairman of the committee and the leader and deputy leader to look at work programming for 24-25. So that is duly worth noting. On the 19th of April, Cabinet actually made a recommendation to you that picks up the wording on page 33 and just on to 34, which is that you've started work looking at the voluntary sector funding review, and Cabinet is now intending to press ahead with its own review at a pace which would have been different to the pace of this committee, and so Cabinet is asking that for this purpose we recognise there's a capacity issue amongst the teams that would be affected, and therefore that you discontinue that review at this stage. So allow Cabinet to press ahead with its review, look at subsidy control requirements, look at the gap analysis of funding that this authority gives, and the extent of a policy statement that would be intended to bring together all the various strands of funding that go to voluntary sector and community groups. So that work, as I say, is underway through Cabinet at a pace which is different from this committee. If this committee, through the intended inquiry it was going to undertake into that, would put, I believe, and the Cabinet believes, undue work pressures on the teams involved. And actually, I'm not sure it would be productive because Cabinet would be going at one pace, you would be going at another pace, and therefore any recommendations that you made out of that process wouldn't accord with the time frame that Cabinet is undertaking. I'm not saying to you shouldn't be looking at voluntary sector and community funding, I'm just saying the review that you commenced has now, I think, been overtaken by events. If you want to look at community and voluntary sector funding, I think let's look at that in the work programme activity for 24-25 that you'll be looking at next month. So if you wanted to have another look at that, let's have a look at how Cabinet is progressing and potentially put it in the work programme for 24-25.
Yeah.
Is there a time frame on that piece of work?
I think there's just a pending decision, so I think it's originally the review was meant to be undertaken within this within last financial year. That has been slightly extended by virtue of the report that went to Cabinet on the 19th of April. So that work, I would suggest, is imminent. Whether that comes in May or comes in June for Cabinet, I think I couldn't sit here and tell you, but it's that sort of time frame that they're looking at.
Okay. And that report will come to us, it'll be out there for everybody to see.
It will be out there for everybody to see.
Yeah. Okay.
Makes sense.
Thank you.
Makes sense to go that way.
I think the thing is as well, I personally think it's quite a big job to do.
Yeah, I think it makes sense.
The report we got
Yeah.
went through line by line.
Yeah.
You know, so obviously that's good, and I think that gives us an opportunity then to maybe, you know, it's quality we should be after, rather than
Yeah.
So I think that will be our idea. So approval recommendation.
Chairman, the recommendation there is to consider it, and I'm taking it from the comments, but it would be useful just to get it recorded that you're happy to see that one discontinued, and that you may pick it up in your 24-25 work programme, but obviously you come back to that in May. Elsewhere, and you may have already received a notification through the calendar invite that the chairman has agreed to a meeting on the 23rd of May to actually consider the outcome of the consultation. So on what should form your work programme for 24-25. I'm aware that the consultation has been live for a little while now. I'm not sure councillors, even on this committee, have yet utilised that facility, so we will try to put that in front of you again, so that if you've got ideas that you want to form part of the work programme for 24-25, this is your opportunity to put that in, whether that's for resources and services or this committee. So I'd encourage councillors to use that opportunity, either because they're members of the committee or they're substitute members. But please do submit thoughts.
Okay, so this is the last meeting in this council year for this committee, so I'd like to thank everybody for their input over the year. I think we've done some really good work. So maybe we should end up on when I was at school, my school report used to say, it's done well, but it could do better. But I'm reliably informed by my vice chairman that school reports are progressing. So the quills have gone away, and there's no more ink monitors or milk monitors. So
But the fundamental message is the same.
yes, that's it. Yes. You've got it. I'm glad to see we're on the same page.
Absolutely.
You forgot the frozen milk.
Yeah, lovely.
So when I first went to school at my gentle and tender age, we had the ink pot and pen. They used to go around and put these ink pots in little holes and put an amazing amount of ink in, and you had this pen. And my reports were, oh my God, unreadable. You wouldn't dare read them. You'd need medication.
Well, on that happy note, the meeting is now closed. Thank you.